This is Dr. Wycliffe Baird, and I'd like to talk to you about man versus COVID 19. We've already spoken about measures that we can use to prevent the spread of the virus, and that is the most important strategy to employ in the first place. But what if COVID 19 enters your system? It might take anywhere from 2 to 14 days before you develop any symptoms and you know that you have the virus. That is, of course, if you've not been tested in the interim. Once the virus is in your system, the battle begins. The main battleground is in the lung, and this is where the enemy has as its target. The virus can live on hard surfaces for 6 to 12 hours, and hence the danger of touching areas that may be contaminated with the virus. Hence the importance of hand washing and the use of effective hand sanitizers or wearing gloves. Once the virus is on your hands, it can gain direct entry into your respiratory system by direct contact of your hands on your face, via your eyes, nose, or throat. There is a connection between your eye socket and your nose and throat, which is called the nasopharynx, and therefore the virus can get into your lungs via this portal. The virus can also enter your mouth from your hands, go into the back of your throat, and migrate into the upper part of your lung. This is called the trachea. From there, it finds its way down into that part of the lung where oxygen is absorbed and sent to all parts of the body. These balloon-type structures are called alveoli, and there are thousands of them in the lung. After the oxygen is delivered to the tissues and utilized, waste is created in the form of carbon dioxide, and this carbon dioxide is returned to the lung and exhaled via the same alveoli. This is what happens when we breathe in and breathe out. We inhale oxygen in the air and exhale carbon dioxide, and this exchange takes place in the alveoli. This area of the lung is the battleground. This is where COVID 19 wants to wage its war. This is where most of the damage is done by the virus. It causes pneumonia and lung scarring in this area. This is a vital and critical location and function, and when this essential and vital function is severely impaired, it can lead to serious illness or death because the vital organs cannot get enough oxygen and the body is unable to get rid of carbon dioxide, which is toxic. Hence the need for respirators or measures to support respiration. The virus can also enter your respiratory system by direct droplet inhalation from someone who is coughing or sneezing. Hence the need for distance separation or wearing a mask to prevent spreading of the virus or contracting the virus. A distance of 2 meters or 6 feet is recommended. But what if all fails and the virus manages to enter your system? Your ability to overcome this virus once it enters your system is dependent on a number of factors. 1. Age. Older persons are more easily overwhelmed than younger persons. But you're not immune simply because you are young. Young persons can be overwhelmed as well. 2. Premorbidity. Persons with premorbid chronic diseases such as diabetes, hypertension, TB, HIV/AIDS, chronic bronchitis, asthma, cancer, etc. These persons are at high risk because the integrity of the immune system is already compromised. It makes it easier for COVID 19 to win the battle. 3. The type of virus. This is an extremely aggressive virus that enters with heavy artillery. It comes with heavy armor, and its intent is to destroy. 4. Your immune system. This is a very important defensive tool in your battle against the virus. In fact, you may get the virus and not even know that you have it because of the integrity of your immune system. A well-fortified immune system allows your body to send out troops to fight the enemy and increases your likelihood of winning the war. 5. Proper treatment facilities. Once you become ill and treatment begins, the battle is on, and it is important to have proper facilities to execute the treatment. Most therapy is directed at lung supportive measures and medication to kill the virus if such is available. Unfortunately, nothing is available at this time. I hope this helps, and we need to prepare the peoples of the world for this battle by boosting the immune system. Thank you very much for listening, and good luck in your fight against COVID 19.